Price plays an important but not exclusionary role in the tender source for work, as sometimes bids are deemed unreasonable if they are too low or too high. That from Health Minister Dr. Dwayne Sands, who today continued his testimony in former parliamentarian Frank Smith's high-profile extortion and bribery case. Smith stands accused of extorting tens of thousands of dollars from Barbara Hanna after awarding her a contract to clean the critical care block of the Princess Margaret Hospital. Earlier evidence has revealed that Dr. Sands awarded Hanna a second such contract to the tune of nearly $2 million without board approval. Dr. Sands yesterday testified that if the tender process exceeds the spending limit, it would be referred to the minister before approval, and this considering the minister has the final say on any contract regardless of how high or how low the bid. As the minister, he said, is a member of cabinet, essentially cabinet would decide and is ultimately able to override the minister's decision. When questioned, the minister further told the court that in August 2017, PMH's cleaning contract was up for tender, and there was what he called a cleaning crisis with the existing contractor who was underperforming, and there were serious concerns. Dr. Sands said he first met Barbara Hanna on June 20, 2017, but had telephone contact with her since November 2016. He added that Hanna donated $300 to his campaign, and her son Andy Hanna assisted him on the campaign trail. Dr. Sands, who was cross-examined by defense attorney Keith Knight QC, revealed that he never awarded Hanna a contract, and that before he approved the contract, he was aware that Andy was Hanna's son. He also was fully aware that she was a contributor to his campaign before she was awarded the contract. Knight QC asked if he knew this, why would he tell her to apply? To which Dr. Sands said he didn't tell her to apply. Knight then read the words, "I told her to apply," previously stated by Dr. Sands. Attempting to clarify, Dr. Sands said he believes he was under the impression that she had already applied and that he was trying to answer honestly under oath, but the way the defense was posing the question was making it difficult for him to answer. The trial resumes on Saturday at 10 a.m. where Dr. Sands is expected to take the stand. The case is before Chief Magistrate Joyanne Ferguson Pratt. Meantime, 3 men who failed to declare tens of thousands of dollars could be jailed. It was earlier this week that Josu Gill, Shid Shah, and Umang Shah neglected to reveal to U.S. Customs that they had over $51,000 on them. The trio was arrested as a result. Today in court, they entered a guilty plea and in return slapped with a $1,000 fine each or 3 months behind bars. As for the bag of cash found on them at the airport, that was confiscated. Troubles brewing on the labor scene, and the government has less than a week to resolve the issues. Our BJ McDermott has more on what's behind the standoff.
The grievances are numerous, yet time has seemingly done little in terms of them being addressed. For nearly 3 years, the Consultant Physician Staff Association, a body of senior trained physicians, claims it has lobbied to have their terms and conditions of its services improved. Association President Dr. Loxley Monroe explains.
Today, if you were trying to get some operation done in that theater, that is not possible. If you go to the emergency room, that is a very chaotic place most of the time. You have 30, 40 persons lying on trolleys. You can hardly pass through there. You sit for hours waiting for service. In terms of the medical and surgical wards, those places are disasters. There's a lack of proper imaging. Our CAT scan has been down, the ultrasound, fluoroscopic machine has been down. Our laboratory services have been totally inadequate for I don't know how many years. Many, many letters have been written. These deficits, as I mentioned, have gone on for more than 10 years.
And according to Dr. Monroe, you can add to this no change in their remuneration packages. That amounts to no health insurance, no pension fund, no salary increase, no increments, and negotiations have reached an impasse.
The CPSA has made every attempt for continued positive engagement with the policymakers, with the administrative arm of the healthcare system, the Public Hospitals Authority. We have met with their negotiation team. We have met with the board of the PHA. We have met on more than one occasion with the Minister of Health, and to date, inadequate, totally inadequate, unsatisfactory results have occurred from these meetings.
Now the CPSA head insists he's not issuing a threat, but that his association will do whatever it takes to bring an amicable resolution to this issue.
From a constitutional point, from the United Nations, from the International Labour Organization point of view, we are going to do whatever is necessary to get a resolution in these circumstances. And that resolution ultimately is to meet our primary goal, which is to ensure that the health care for our nation is guaranteed, secured, and will continue to improve.
Dr. Loxley says all they're asking is to at least be met halfway with their requests. Reporting for JCN News, I'm Berthany McDermott.
Well, following this morning's press conference, Trade Union Congress President Obie Ferguson indicated plans to file a trade dispute with the Department of Labor for a strike vote.
As a group, we will do what we have to do to make sure this thing become a reality. And this ain't no sitting around, we meet today and we can meet next month. And if they decide to meet, it has to be on a consistent basis so we can get this over with. And I mean, all of us will stand together and we will see how long they're going to hold out.
Mr. Ferguson has since confirmed that the dispute was filed this morning. The CPSA is certainly not alone in its fight. Standing with it are its union affiliates from the Department of Customs, the Bahamas Power and Light, Water and Sewage, teachers, sandals, straw vendors, and nurses, whose president Amantia Williams offered up this bit of advice to the health minister.
Get it right. You need to get it right. Deal with the issues. There's no reason why no one should be working anywhere without an insurance. Come on, 10 years without an increment? No, that is the problem there, Minister. Deal with that.
You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.